Listen up. If you or someone you know has a positive ANA, positive anti-nuclear antibodies, you need to hear this. It might just save your life. Now, an ANA is a blood test, and it's not a routine test run by most medical doctors. We do run it in our practice on everyone because it's a huge marker and a big red flag for impending health problems if it comes back positive. But let's talk about how it's used in the traditional environment. A person who would normally get an ANA tested, it would be by their primary care doctor, and it would be done because of not feeling well. Brain fog, fatigue, aches and pains. You just don't feel well and you feel like something's wrong, but your regular doctor can't find anything. You know, your blood count looks okay, so you don't have anemia. Your thyroid, well, the thyroid looks okay, but they're only checking one lab and not all the labs that they should be checking. That's a whole nother topic I'm not going to go into right now. But eventually, if you're persistent and you don't give up and accept the answer that this is just how it is when you're 40s or 50s, eventually they'll run a test. They'll dig deeper and they'll look at something. And if your ANA comes back positive, they'll go, whoa, now what do we do? Well, what they would do is send you to a rheumatologist. Now, a rheumatologist is a specialist in internal medicine that did an additional 2 years fellowship after their internal medicine residency to learn about immune system disease and immune system dysfunction. Now, the rheumatologists are very smart. They're some of the smartest people I know, actually, but a lot of them are super traditional. And so over and over again, I talk to women who have come to see me. And now when we're talking in detail about their history and they knew maybe a few years ago that they had a positive ANA, they'll all of a sudden remember that. And they'll go, oh yeah, my doctor a few years ago found this blood test that was abnormal and it was a positive ANA. And they sent me to the rheumatologist. Well, what the rheumatologist does is they ask questions and they're looking to see if you have enough of an issue to have a diagnosed autoimmune disease. There's a huge difference and a large time gap, about 10 to 15 years, between the positive ANA and when you have enough end organ damage to classify yourself as autoimmune disease. So if you don't have an autoimmune disease, then often what the rheumatologist does is they look at you and say, yeah, well, that's not normal, but you don't have an autoimmune disease yet. Come back and see me when you feel worse. And then I can give you either steroids or methotrexate or a biologic, some sort of immune suppressing medication. Really? Really? That just does not sit right with me. So something's wrong. Your immune system is building antibodies against your DNA. That's what an ANA is. Anti-nuclear antibodies. Now, your DNA is the recipe book that contains all the information on how to make all the proteins that your body needs for hormones, for neurotransmitters, for bone, for muscle, for everything, for intracellular enzymes that get things done. Your DNA is protected inside the nucleus, buried deep in your cell. And if your immune system is reacting to it, it means that you have had significant cellular damage where the nucleus is disrupted and the DNA gets exposed to the immune system. The immune system builds antibodies against foreign proteins. And yes, your DNA is not supposed to be exposed to your immune system because it's supposed to be buried deep inside your cells. But if you get this positive ANA and you have cellular damage so that your immune system is reacting now to your DNA, that's a sign. That's a big red flag. And whatever caused that damage is still there. And the reason that there's a time lag between when you're given the diagnosis, yes, you have a positive ANA, but the good news is you don't have autoimmune disease yet, is because all that time during that 10-year period, more and more damage is being done. Whatever is causing that disruption, the cellular damage, more and more damage is being done. And eventually enough damage is done to your body that now it's recognizable as an autoimmune disease. So if the end organ damage is your gut, then it's either Crohn's disease or ulcerative colitis. If it's your joints, it's rheumatoid arthritis. If it's your blood vessels and soft tissue, then it might be lupus. If it's your skin, it might be plaque psoriasis. That's what these diagnoses are. It's a clinical diagnosis. It's made of immune system dysfunction plus enough end organ damage that they can classify it as a disease. And then what's the treatment? Well, the treatment's the same: steroids, methotrexate, or some form of a biologic that suppresses your immune system. So let's talk about that. What about these medicines that suppress the immune system? Yeah, they get rid of plaque psoriasis, but you know what the side effects are? Cancer and funky infections. Now your immune system is so suppressed that it can't fight off these infections and can't fight off cancer. So to wait until you have enough symptoms and then say, okay, now we can treat the symptoms with immune suppressing medicines is crazy. But that's all they have. They don't believe in their traditional medicine mind that there's something we can do about it. Well, if we know the trigger, then there is something we can do about it. Your immune system, God made your immune system to fight viruses, bacteria, and cancer. And if your immune system is attacking body parts and DNA, something's wrong. So figure out what it is, what's causing it. I'll tell you, in my experience, it's toxins, infections, super high stress, like trauma in your past. Those are the things that lead to this massive body dysfunction that starts out as a positive ANA and ends up as autoimmune disease. I don't want that for you. I want you to be healthy and thrive. And if you have symptoms like brain fog and aches and pains and gut, not massive gut symptoms, but just like this discomfort and this bloating and something's not quite right, and you're tired, those are signs that something's wrong. And eventually it might show up in blood testing like that positive ANA. And if it does, it's a huge red flag. Do not ignore it, and do not think there's nothing you can do. Don't take no for an answer. If your doctor tells you, oh yeah, don't, come back later, there's nothing that can be done, then find another doctor. You need to work with someone that understands the root cause of illness and believes that healing is possible. So a functional medicine doctor, an integrative doctor is what you need if you have a positive ANA. I have seen the blood tests reverse. I have seen the immune system balance. It's possible. So get help. And if you know somebody who has this positive ANA, please show them this video. We need to get the word out. We do not accept this as a normal environmental response of aging. This is not normal. Your immune system should never attack itself. And if it is, it's not just genetics. Something's wrong. Something's triggered it. Listen, genetics loads the gun, but environment pulls the trigger. Even if you have a family history of autoimmune disease, it's not your destiny. It means that that's a likely way that if your body's going to break down, it might break down in that way, but it's not your destiny. Something still has to trigger it. And that's what we do in functional medicine. That's what we do at Vitality Renewal. This is my passion. I see women over and over again who don't feel right and are just enough of an advocate for themselves to keep asking questions. And then eventually they get this diagnosis. And if they still know how to ask the questions, they can get help. They get their life back. They feel better. You have a God-given mission to do, and I want you to have energy and clarity in order to get that mission done. And a positive ANA is a big red flag that's eventually going to get in the way of you doing what you were put on this earth to do. So get help.